I think actually we can go ahead and get started on our conversation. And as folks join us here, we'll continue on with that. We want to thank everybody for joining us, not just the people that are on the screen right now, but all of you that are tuned in for this conversation. If you had an opportunity to listen to the last 10 or 15 minutes of our opening session, you would have heard underscored the need for serious thinking about community relationships, about community engagement. And we have just a tremendous panel here to talk about that in a serious way today. That said, it's, I think, the organizers' sincere hope and my sincere hope here that this is the beginning and a continuation of a conversation. We're not going to solve all of our problems here in 45 minutes together, but we are hopeful to make some connections and to put some ideas on the table as to how we can do a better job going forward. I think that this whole event is partly a recognition of the fact that Duke can do better. And we need to. And I think this is hopefully going to be an initial starting point in that longer term conversation. So we're here partly to talk about who we all turn to in moments of crisis, and who we turn to for information, and to learn from that a bit. We're going to learn from some best practices with regards to community engagement as it's been done well here in the Durham community and in North Carolina. And we're going to explore how Duke can become and continue to be, in some instances, a trusted partner in those conversations. So we've got really an exceptional panel, and I wish we had hours and hours to talk with each. So we're going to hear from each of them, and you're going to, I think, have a sense of that if you don't already, to just appreciate what a wealth of experience and expertise we've got here. We've got leaders from local nonprofit organizations that are on the screen right now, including Kendra Johnson, Executive Director of EqualityNC. We also have Pilar, Rocha-Goldberg, President and CEO of Centro, Hispano. We've got Nia Wilson, who's Executive Director of SpiritHouse. We've got an opportunity to talk with members of the Duke research community. We may hear from Fan Lee a little bit later on. And we've also got leaders who are doing a lot of important community engagement work, who work for the city of Durham. Constance, Stancil, and Lynwood best. And we're going to hear from about some of their experiences in terms of thinking about neighborhood improvement, neighborhood outreach in ways that I think can directly inform a lot of these conversations we need to have. So we want this to be a conversation. We want to hear from everybody. I have a few questions that if people are okay with that, to kind of start this conversation. For a few minutes, I want to talk directly about ideas related to community engagement. And here we want to have a conversation which we're highlighting successes, but also talking about challenges in some very important ways. And so we'll first hear from some of our nonprofit leaders who are on the screen. And then we're also going to hear about the city government experience. But I want to open the initial part of the discussion here with an example. An example that is very recent in the context of this pandemic, and an example of the work that SpiritHouse has done directly to attempt to engage with different communities and to put positive messages out there. So I'm going to just share my screen briefly here just to show you an example of a campaign that hopefully you're seeing on the screen now, an example of work from SpiritHouse, and you'll see that. And there are numerous examples of this from a local campaign effort. I'll show you just a couple here that are really illustrative of the work that SpiritHouse has done. And I'm going to invite Nia Wilson onto the screen here to talk about this, to talk about the experience of developing that effort, but also her thoughts on community engagement sort of in general. And so Nia, thank you for joining us here this morning. I want to turn over the stage here to you to talk just a little bit about your thoughts on community engagement and what we might learn from the experience of SpiritHouse thus far.
Thank you. Thank you so much. I'm so glad to be able to be here this morning. SpiritHouse is a cultural arts and organizing organization. And so we use media, we use art, we use culture to be able to amplify the needs and the visions and the voices of Black people in Durham and actually across the South. So, you know, these past few months there's been sort of a double hit in our community, both with Corona and COVID and you know, the numbers that have been produced about the risks to our community, and also with the exposure, the increased exposure to violence in our communities by police officers. And so both of those things over the past few months have been very impactful in our community. It both emotionally, mentally, spiritually, that has sent us into a state of grief as a community. And sometimes it's unrecognizable by folks that, you know, people understand that grief looks different in different ways. You may not understand it as grief, but we've been dealing with a lot of grief, a lot of sadness, a lot of anger. And so we try to use our media platforms, our social justice platforms, to get folks to connect to what you're dealing with, what we're dealing with, and sort of being able to find ways to move through what some of us understand, you know, that are happening in our bodies, the increased cortisol, you know, the increased tension and all of the feelings that we have. And so we had two campaigns that we were moving over the last several months. One was Black People Breathe. And as you saw in one of the pictures, it says on the count of 3, breathe with me. And it literally is just encouraging people to take deep breaths so that we can reduce our level of stress and anxiety, to acknowledge what the grief and the fear and the anger that folks are feeling, and also to talk about the fact that we have the ability in our own bodies to just calm ourselves down, to be able to face the things that we're facing. And so we were sharing those different photos of children, of adults, there's lots of them on our Instagram page, for just encouraging people to take a moment and take a deep breath. We also have on our YouTube page a couple of meditation videos that also begin with, on the count of 3, breathe with me. So anyone who has looked at or been to our YouTube page and seen one of the 2 videos up also recognizes that on the count of 3, breathe with me kind of statement. Then we also, you know, in our trying to figure out how to have us talk through what Corona how it has impacted us, we also sort of took a stab at this who's essential piece, because, you know, historically, we have not been seen as essential to the very fiber of this country, except for our labor. And so, and now we have been essential, even folks who work, you know, low wage jobs have become essential to the comfort of folks who have more wealth. And so we wanted to, again, address this "you are essential" piece by saying that we're all essential. We always are all essential, even if it's just to our families, to the people who love us. We need to be able to understand that we are all essential, and that it is important for us to see ourselves and to see our families as essential. And so we started a series. We partnered with Ngozi Design, which is a design collective of folks who they had a store downtown for a while, who specialize in African-centered clothing and other products. And so they were making face masks for the community. And so we partnered with Ngozi, and we have, I think, distributed Oh, I think probably over about 500 masks that have like an African pattern to them. There's also inserts in the little package of the masks that are encouraging quotes from folks in the African American community. And so we partnered with Ngozi. We also partnered with La Samilia, who also is an organization that's been doing food distribution. And we gave masks to them, as well as some herbs, some healing herbs and things that we also partnered with another herbalist, a Latina herbalist. And we were able to also provide sort of tinctures, wellness type tinctures for folks to be able to take during this time. But the goal was always to have people understand how essential we all are to each other, and that it's important for us to put ourselves first. And so while we're having all this conversation about protecting other folks and making sure we're not transmitting diseases and corona, it's important for us to understand that we have to raise that message about how essential we are, how important we are, how valuable we are, and therefore how important it is for us to take care of each other. And so again, you know, as I said, there's several photos in this series that are on our Instagram page, on our Twitter page, on our Facebook page for folks to look at.
Thank you. There's so much in that comment, not the least of which, though, is just this really important reminder of the fact that everybody as individuals have dynamic lives, and that, you know, things are different in 2020 than they were 2018 in some ways. You know, we often think about community engagement as though we're somehow reaching a static, you know, community, and this idea that we've also got to pay attention to the history that you know, many people are going through, we're all going through right now, is really important to our conversation. So I want to shift here and ask a similar question to Pilar, to talk about you know, the experiences of El Centro Hispano, you know, in the last, you know, few months, but then also thinking beyond that, on this theme of community engagement. What does it really mean? And we heard some great examples of that from Nia just a moment ago, but if you could add to that, Pilar, that would be great.
Yeah, thank you so much, Brian. Thank you, everybody, for having me today. Yes, this, I think with this pandemic, we were able really to do what we say you should do, to engage the community, is to listen to the needs to the community and act to really support the community. And that's our mission, yes, at El Centro. So when the pandemic started, we started listening from people about they needed food, mainly because they were getting laid off of work, the places were closing, so they needed food. We always, our approach for that, we don't have a food bank, but always we collaborate with other stakeholders. So we always refer people to the different services. The issue at that point when we got together with people who were having food to distribute is that they weren't able to get to the Latinx community. So when we look at the other side of the thing, we were hearing from the community members, they got food, and some food they didn't know how to prepare because it's not part of their culture. So what we did is we started calling for people to donate food, and we started distributing food. So we got together with our management team and said, okay, what do we need to do? This is the need of the community. So we restructured our organization in a way to go virtual for services, to open more phone lines for people to call us so we can direct the calls to the homes of our staff members so they can respond to the community, open more lines for the social media. Our community lately has been more active in Facebook and Messenger, and it's a way they are communicating with us. So we put in place somebody to be there all day responding to these needs to the community. And then the other thing we were looking at was the communication about the COVID, yes? What is happening, what is it, how do you need to take care of yourself? And all the information was in English. So we weren't finding information in Spanish, or there was some information, but it wasn't culturally appropriate for our community to understand what was happening and what to do. And also how to access to some of the services, because we know there are gaps, big, huge gaps in and disparities for our community that existed before COVID and were highlighted with COVID. Yes, like access to healthcare, economic development, paying for sick leave. So we developed communications campaign. We got together with Spanish media outlets and we developed a communications campaign together, putting out messages that the community could understand and everybody could share with everybody. So then we again finished restructuring our organization, and almost all the staff went to help people over the phone with different needs they had, distributing food, open up emergency fund to help people to buy food. So what we did is people applied for it and we bought the food in Latinx supermarkets so people could get the food they usually eat, and also to help with rental and utilities assistance. And at the same time, taking advantage of this point and to going to what Nia was saying is that, that we were in the front line and now we were seeing, unfortunately, a lot of the cases were in the Latinx community, yes, disproportionately affected. So in the state, we got almost to 40%, and we are 9% of the population in the state. And in Durham, it was a week we were 80%, almost 80% of the cases when we are 14% of the population. And that has, a lot of things are the need, but then we were somehow, not in a good way, in the statistics, and everybody was trying to get to the community and how we can help the community. So taking advantage of this situation to continue advocating for the community and advocating again to tell people, highlighting that these disparities existed before, this is not new for us, now are highlighted. What are we going to do not only to help the community right now, but also when we go back to normality, that we don't know what that means yet, but we don't want to go back to where we were previous COVID. We want to go back to something better, yes, to something that really takes care of the community in general. And I think this also helps thinking about how we can help to talk about community and stop dividing the community so we can really engage the community. And also how minorities, we need to continue getting together to share the resources that are out there, because the pie is not getting bigger. Yes, it's the same pie, but how we can stop fighting with each other, but take advantage of what is going on. The other thing we did, also to Nia's point, was we were seeing people with, again, no jobs, getting problems with paying rent and utilities, and we went out to the community saying, and people needed masks, yes, so we went back to the community saying, who is making masks? And we started buying masks from community members that were making these masks so we can support them and also support the community using masks and distributing masks. And we continue doing that and working with more community health workers. That was the other good advantage we could take care of, is because they needed to get to more community members, they were able to put out their money for minorities to hire community health workers to get to the community. And what a best way to bring our own community members as community health workers so they can really work with their own community to support their needs. So right now we are working on that and looking again at how we can leverage from this to continue when the pandemic is over.
Yeah. So Pilar, something that's just quite humbling, even just to realize, and you had a few minutes to talk about this, and the number of times that you emphasize need and identifying and recognizing needs and starting there. It's just really important, I think, for our conversation, and something that we easily overlook. That maybe that one of the most important things we can do is just have a better sense of what our community's needs are, and then think about how to address those, and then a lot falls into place after that. So I appreciate that that comment and so much of it. I also want to bring Kendra Johnson into the conversation here to talk about the experience of EqualityNC. amidst both the pandemic and more broadly, and with ideas that might inform our conversation. So Kendra, what ideas do you have on that?
Yeah, I want to echo a lot of what Nia and Pilar said, that I think the starting point for us dealing with this new scenario of misinformation coming from, frankly, public health officials and from the highest office of this country, we wanted to ensure that we had a good sense of what our community needed. So one of the first things that we did was actually to do a caller program and call through our entire list of membership to check in and do a survey to understand what people understood about COVID, what were their basic needs, what were their greatest fears. And based on that survey, we were able to shift some of our programming as we were shifting to digital. One of the biggest issues for folks, besides food insecurity and transportation, was just a feeling of isolation. And so we were able to create particularly a program for our elders who many times, because they are LGBTQ+, do not have good familial connections because of rejection and stigma, and pair them with youth who are LGBTQ+, who might have been going through the same things at home with their families, to have a friendly caller program to check in on our elders, to make sure that their needs were being met. And also create forums where we were intentional about ensuring that folks knew how to dial in or were guided through new technology in order to have a point of connection regularly with other elders where they could voice their concerns and we could ensure that their needs were being met. Externally, we looked at how we could translate the information that was coming from news and media and to laser target that to the LGBTQ community, i.e., many people in the beginning, there was a lot of misperception that Black folks were immune or that these different groups would not be impacted. And we were able to pull together with some national partners information on the disproportionate impact that it was having on Black and Brown and LGBTQ+ people, particularly the trans and gender non-conforming community, and get that information out to also talk about the impact of loss of employment, which was also disproportionately impacting Black and Brown LGBTQ+ folks. And to also be a hub we don't do mutual aid, but we use our platform to elevate the mutual aid resources that were available, including when there was a call for people who were not resource poor to donate part of their stimulus check to the communities that did not receive stimulus checks. So for the folks who were not in need to share their resources, we elevated that. And then from an advocacy standpoint, we joined forces with a group of 200+ organizations that were really elevating the needs of the folks who are always forgotten, because as Nia and Pilar said, we're always essential. We are always in the low wage earning jobs, and we are left behind when there's a hurricane, we're left behind when there's an economic crisis. And so we joined force with the folks who were in the Fight for 15, folks who were fighting for climate justice, people who were fighting for Medicaid expansion, to really pull together and articulate a list of 10 needs to ask that these communities receive resources from our NCGA, and that these be targeted to combat hunger, folks who are undocumented, low wage earners, et cetera, to create a baseline of support. And we were able to share resources, information, and mobilize together to articulate the needs of the community that's also always left behind. So I think our role is really sharing information, addressing the needs of folks who are left behind, and trying to underpin the organizations that are providing the direct service, so our folks get the assistance that they need and they continue to have a sense of community in a time where we're all facing some level of isolation. That's been the approach that we've taken.
Great, thank you, Kendra. And it really helps to further emphasize just the importance of relationships, here, and as you think about, helping people overcome misperceptions, but also just again reaching and meeting needs as a first priority. So we've had a number of instances about the experience this year amidst the pandemic. I want to turn our attention now to a story that's a couple years old, to a story that Constance and Lynwood will tell about the city of Durham around the turning point of 2018, and some of the instances in which they were able to read and learn from some of the experiences they've had in trying to provide neighborhood improvement. So I want to turn to Constance, and then maybe we can turn to Lynwood, and the two of you can talk a little bit about the experiences that you've had in trying to provide neighborhood improvement services to the city of Durham, and how that actually fits into our conversation extremely well. Constance?
Yes, good morning, and thank you for inviting me. I'm so excited to see Nia and Kendra and Pilar. These are people that you see in the community that are really, they have really challenged us to change how we do our work in the city of Durham. And I was just gonna tell you a story about in 2018, the city was getting ready to develop the Durham Beltline, and a group of residents came down to city council and said, hey, wait, stop. You haven't engaged us. No one has talked to us about this project. We don't know what's going on here. So city council stopped the project, and they charged the city administration, which charged neighborhood improvement services, with the task to come up with a engagement plan around the Beltline. That is the downtown Beltline. And we had 90 days to do it. We thought, since we were community engagement for the city of Durham, we thought we knew how to do community engagement until we spent almost 90 days working in the community, actually asking the community what it meant to engage them and how they would like to be engaged. And out of that process, what we developed was a blueprint, and blueprint to engage residents in the city of Durham. And based on that blueprint, we were able to then develop an engagement plan for the Beltline Trail. I can tell you that I said to the city manager, he said, Constance, you've been telling me for 8 years that you knew how to do engagement. I said, well, I thought I did until I really asked the community about how they would want to be engaged. And they really taught us a lot. I tell you, the expertise around engagement is actually in the community. Building relationships, building trust relationships is the foundation to engage in the community. We found that out in our 90-day discussion with the community, and that allowed us to build the blueprint. And I think Lynwood has put the blueprint in the chat, so if anyone would like to pull that down. And that's a draft document that we continue to work on with the community and city staff. The other thing that has happened since then, since we had this major paradigm shift, our staff started to look at who we actually are as the engagement staff for the city of Durham. And so there's this quote that we picked up, that I picked up, and we have adopted it in our department. And it goes like this: if you've come to help me, you're wasting your time. But if you come because your liberation is bound up with mine, then let's work together. And that's by Leah Watson, an Aboriginal educator and activist. And so we started to see people differently in the community. We actually said, okay, our humanity, we believe our humanity is tied and linked directly to the people we're serving in the community. So now we stop and we see people, we acknowledge them, we understand their pain, their concerns, and we respect their involvement in what we do in the community. So over this last, since March, we looked at how we engage the community differently. Normally we would have brought them something. This time we asked them what their needs were, and they told us in no uncertain terms. And over this last, I guess, 7 to 8 months, we've done a lot of things with the community where we've co-led and we've co-created and we've co-designed. And one of the things that we've done during COVID, we have responded to needs in real time. A lot of people did a lot of virtual things, but working with SpiritHouse and other community partners, we have served the residents' needs in real time. And then it's going to tell you about some of those things that we've done.
Great. And Constance, just a note here that for folks that are interested, even just a quick Google search for the community, for the blueprint, the community engagement blueprint, City of Durham, we'll raise that as well. And then we can also try to get that, that link out to Lynwood. Please go ahead.
Thank you very much. I really appreciate it. Our tagline for since COVID-19 started is, yes, we're open for business. And that's what we were. We were open for business because we know the need was out there. The need was out there before COVID came. After COVID hit, it was just like, we really need to be there. As Constance stated, we actually went out into the community and say, what can we do? How can we help? What are your needs? And we were very fortunate that we had other partners that were out there as well. Summit churches and Nehemiah Church and other churches called us and said, how can we help you help our community? And they actually partnered with us to help us do food drive, get food out there, because people say we don't have enough access to food. We need food. We don't have access to cleaning supplies. We don't have access to masks and things of that nature. So we really were out there at bus stops and places that people said they needed those things. And we actually had a lot of distribution for us, face covering and masks, and a lot of information about COVID-19. People didn't understand what it was, how would it affect them, how would it affect their family, how does it travel, all the health information we can have, we had it out there in the community. And they also said they needed different programs and different things. So we worked with them to do different programs like the Morning Glory. We had a matching grant program prior to the COVID-19. We actually rearranged it so that it would be something that we can work immediately. People in Morning Glory said that their health worker couldn't come in their community center anymore to help them measure their blood pressure. We actually went out using that grant, went out and purchased blood pressure equipment, so they were able to do those type of things without someone being exposed to the corona possibly in that building. And so it was programs like that. We did Family Island. People said they were stressed, they were tired of being at home. We worked with the bike co-op to create a bike family island where you actually went out to Walk Quarry Park, which is a couple of miles away from some of these people, some of the residents that were asking for this escape. It was a couple miles away. They weren't aware of it. Just getting them exposed to it, getting somebody that does like helmets, bikes, to go out there in the community just to take a bike ride with your family, get to know your family, get some of that stress off of you, get a chance to shake some of this, all of this that's on you dealing with the COVID-19 and actually enjoy family life. We actually work with the stimulus checks where we're able to help families get over $81,000 back into the community that they weren't aware, didn't know the processes. We took our City Hall on the Go vehicle out there, which is a mobile unit that we use to take into the community. And our tagline for that is, we see City Hall on the Go coming, help is on the way. So we really try to be out there in the community to help them. Some people said that they wanted something for their children. So some community actually did a virtual art class. She purchased the supplies, put them on people's front doors, gave the children an opportunity to create these paintings and these artworks and these things. And then she actually collected them all, put them in her backyard and create like a backyard museum. Allowed them time where they can actually bring their families and show them their artwork. And this whole community had an art show. And it was very exciting. And we had a virtual cooking class where the food was purchased, put on people's front doors. They'll actually get on the computer, actually learn how to cook healthy foods, know how to season them properly and correctly and exciting and health-wise. So it was really enjoyable. Daughter say, hey, Mom, let's do this together. And it creates a family bonding. We also create some Find My Yoga programs where we actually had yogas outside and 6 feet apart. Everything was social distancing. But also, as we went along with the process, we did a back to school drive as well in the community. And these are community events that we help partner with in the community to do. But we realized too that as COVID was moving along and school was opening up, that there was some digital divide there. People were having these computers in their homes and not knowing how to operate them. So we actually brought in some computer people to help families that had problems with Wi-Fi, connectivities, and we actually had a workshop that allowed the families to talk to the Board of Education about their concerns about this great divide. And I don't know how to work this computer. This is more advanced than I know. Please help me get somebody in here to help me do these things. Because we found one student sitting there 6 days, not knowing how to connect to Wi-Fi and missing classes. So we were able to do those things, which were very exciting things to do. We also had conversations, community conversations, where we actually had 2 of them that was in Spanish. And we reached over 2,000 people in each one of those conversations. And the conversations were dealing with COVID-19. What was the cause? The same things, the cause, the effect. What can I do? It was great. And we also participated in a virtual town hall conversation about COVID and beyond. So we've been really, really excited about the things that we're doing in the community about COVID and trying to help community. But all of this has been done because the community said, this is what we need, this is what we want. It was actually going out into the community, having a conversation with the people in the community to find out what they wanted, what they needed, and how we could help. I was told when I first got community engagement that we, as the community, said, we know what we want, we just need your help in getting it. Yeah. And we know what we need, we just need your help in getting it. So that's what we're trying to do. Help those community people doing these programs that we think will help benefit them, help them through this pandemic. They needed help prior to the pandemic, but this is also to help them to get through this pandemic as best as we possibly can.
Great.
Brian, can I say that Nia and Pilar and Kendra, people like those are the community partners that helped us do this work. We were not the main ones to do it. SpiritHouse was one of our community partners who directly worked with us to do, so many things. We had a Juneteenth parade, and that was about getting information out about the census, about COVID. They've done so many creative things, and we are truly partners with them, and they are the ones who are driving this. And I want to say thank you to the 3 of them and all of the other community partners that we have in the city of Durham.
Thank you to all of you. There's so much, just on a deeply personal level, honestly, to have an opportunity this morning to be so inspired and to celebrate some things amidst everything else. It's wonderful to be able to have that conversation. Something that we can challenge everybody that's on the line right now. It goes to Lynwood's point. Here we're having a conversation this morning with a few hundred people. How do we ensure that we have further conversations with thousands? How do we ensure that we are able to bring more people into conversations like this? We're in a situation being able to take advantage of some technology. What else could we do to broaden that conversation so we're hearing more voices going forward? So just some food for thought, even as we have this conversation right here. So I want to bring Fan Lee into the conversation because this panel, this discussion, we wanted to talk about how through building trust, we might actually help people avoid challenges of misperceptions. And I want to talk a little bit about some of those misperceptions about science and those misperceptions that have been circulating. And I'm seeing here, and I might have some internet instability, so I apologize if I'm a little bit glitching here. But Fan, could you talk to us a bit about some of the misperceptions that you've heard and things that we might want to be thinking about in terms of helping our neighbors through this situation?
Thanks. Thanks first to Brian and Don for organizing this wonderful and very timely event. And also second, really thank to my co-panelists. I feel that it's really humbling to hear this morning that what you have done in this very difficult situation to help the community to go through this horrific pandemic. So I come from, I'm a professor at Duke. So and also I'm Asian American, so I offer a little bit different kind of perspective, my unique perspective, my personal perspective to this. So this is, this pandemic really affect different people of different community or different group differently. It's particularly disproportionately affect the already disadvantaged group, right? So we all know that. And as Asian American, so we, one thing is interesting is I'm a Chinese American, and then when I go to the street, everyone will see me as Asian American. Nobody will see that whether I'm Chinese or Korean or Japanese, right? So we're all lumped into this Asian American perspective. And of course, the pandemic really started from China. And so in the early days, actually 2 months before, all of this, the pandemic come to US, that the Chinese community already very aware of, well, this terrible disease, but nobody at that time saw that this will actually circulate to US and then actually become a world problem. And also some background before that was, you know, the US and Chinese relationship, of course, wasn't that good. So then this is kind of a double hit. Once it's come, so these things, it's already not good. And again, this is not, so there's already like the anti-China or anti-Asian sentiment already was high. And then the COVID pandemic doesn't help. So so actually there's a statistic showing that the anti-Asian crime or incident has increased dramatically after March. And so again, that is kind of expected, but that's sad because when we're talking about locally in Durham, we don't have a very large Asian community, but actually the Asian community is pretty focused, concentrated in the universities. There's a lot of foreign students, a lot of Asian students. And for those students, it's really, again, the hit is really a triple hit because first of all, they are separate from because the isolation, right? And the isolation as everyone. So, and also they're being accused of, well, not accused, but they are, you know, again, the anti-China, anti-Asian sentiment really affect them more. And also because they're isolated, it's much more difficult for them to get the necessary support, mental support. And also, the misinformation also goes both ways. And now you go back to, if you read the media in China, then there's also like all the students, all this Asian Americans or Chinese Americans living in US, they cannot, if they want to go back to China, visit their family, you know, there's no way, they're not allowed to even get into the country. And then they are subject to very severe like monitoring and things. So, and I feel a lot of the students, especially the student first, this might be the first year or second year they come to US, and they got hit hard really by this. And I think Duke is doing a great job trying to help to provide the mental support, the emotional support for those students, but still it's just a long way to go. And as faculty, we usually try our best to, you know, we talk to our advisee and periodically make sure that they are okay. But that's, you know, I always feel that we probably can do more. But again, all of this, you know, all the isolation make life difficult for everyone. But again, I think I have to say, comparing to a lot of the economically disadvantaged group or the minority group or LGBT group. So maybe what I just said, the Asian Americans or the Asian students is just a very small portion, and comparing to others, it's not as severe. But I still want to point it out, like this pandemic really affect many different groups pretty hard. And so I really appreciate all my co-panelists, what you have done. I think this is wonderful. I just hope more people can do this, and also I hope that, you know, that people can be united. And people really, unity is important in this horrific times. And let's hope that we all get together and address this issue.
Yeah,
thank you.
Thank you, Fan. So we have just a few minutes left, and I want to open the floor here. You know, given the audience that we have, if there are thoughts and comments and takeaway messages that people want to express, I'll just offer just a brief one that kind of connects the dots here, and a really important theme. I think back on the experience in Philadelphia a few decades ago when they were evaluating a vaccination effort. They spent a lot of money on a very well-crafted communication campaign. Ultimately, it didn't work. The question was raised, you know, why? And we spent on persuasive messaging. And something they had overlooked, and something that they heard loud and clear, was that they had opened the clinic at sort of odd hours, that people didn't know when they could get there. There was a lot of concern just about the logistics. Most important piece of information was, how am I going to actually get there? Because I'm working at this hour, working at that hour. A really important oversight. And I think we're hearing that again here. We have to start from need and start to understand what it is that people need in their lives, and how can we do a better job of listening to that. So I want to open the floor here. If anybody's so moved, some last thoughts that you'd like. Maybe come back around to maybe Nia and Pilar. We sort of started our conversation, but anything that you'd like to just quickly note here for this audience, and then hopefully we're having additional conversations after this. But yeah, maybe Nia.
Yeah, sure. I really, really appreciate this panel and everything that I've heard. It helps me to understand just how important it is for us to collaborate and work together, to not be siloed off. Although we all work in different demographics, each area each of our demographics is important. And the needs are different for each of our demographics, but there is not one that is less than the other. And so it is really, really important for us to find a way to work together to be able to grow what we're doing so that all of our communities' needs are met. I think in speaking about misinformation and mistrust, a thing for the institution to think about is the history of the institution's impact in the community, and that the way to shift that and to build trust is to work directly with the community organizations that are doing the work. And so, when I first started working in SpiritHouse, and we used to get lots of requests from Duke, from students or from different people who are doing different projects, and they would send us the project and say, can we get your help putting this out into the community? And we would say, absolutely not, because you didn't come to us or come to the community as you were developing the project. You developed the project on campus and then expected us to help you facilitate it happening. And that's not how we work. And it was years and years and years and years and years and years before that shifted for us. Because we began having relationships with people at the university, as opposed to relationships with the university. We began having relationships with people who were there, and then we built trust and were able to work with each other, so that we weren't necessarily thinking about this entity, but we were thinking about the individuals and what they were trying to do at that level. Again, we are not academics. And so, and there is a need for academia in this society. And so then how do we develop relationships in all of these different places so that we can work together and accomplish that? I really love what I've heard. I would love to find ways for us to continue to work together so that we can get the resources that we need for all of our communities.
Yeah, and you're phrasing there just a little bit, but you left us with plenty of food for thought.
The last thing I want to say.
Go ahead.
Okay.
No, go ahead, Nia. I'm sorry, you're back. Yeah.
Oops. Well, I want to say something before I hop off. And maybe
yes, please.
So I just want to echo what Nia was saying, which I think is important, is that in order to build trust with the community inside of academic institutions and medical institutions, the approach cannot be theoretical. The approach cannot be academic. You have to have directly impacted people who understand their own lived reality at the table, conducting the work. I think all of us have said that to a certain extent. I think Constance said that you thought you knew community outreach until the community told you how they wanted you to be engaged. I think that goes forward, where I think the community of LGBTQ folks, Black and Brown folks, folks who are disabled are tired of people approaching us with theories about our lives that do not directly engage us in conducting how we address the problems that we live every day. So that's for hospitals, it's a consumer advisory boards. For academia, it is looking around the table and seeing who's not there and making sure that they have a meaningful role, not just for consultation, but in shifting and shaping the work that you propose to do. That's the first big step towards building trust.
Such an important point. Nia, if you're back, I just want to give you an opportunity. You broke up there a little bit at the end.
Oh, I'm good. I was making a joke.
Well, I'd like to hear it actually. Yeah.
I was just saying I'm going to steal the idea of the cooking classes from the city, because I think that
we'll work with you, Nia.
That's the most.
We'll do it
maybe
with
the
you.
most important thing.
I would love to do that. I think it's an amazing idea. And the thing I do want to add about that is that the way that being able to connect with the people who are already doing the work is important. So connecting, for instance, with restaurants who are also impacted by COVID to teach a cooking class and provide the food is one of the things that we've been trying to figure out how to do. And that way it brings resources to the people who also need the resources.
Yes.
Great.
If I
go ahead, Pilar. Yes, go ahead. Yep.
One thing, I've been in the both sides. As I started working actually at Duke in research when I came from Colombia 16 years ago. And then I became the CEO of El Centro after I learned about the community and I wanted to do something different. So I think it is important to understand the roles of each other, the institutions, the research, but also the stakeholders and the nonprofits. And also that I think Duke is changing, but I think needs to do more about it is, as the point of Kendra was saying, when come to work with us and to get to the community, I understand the mean is a good meaning, but also understand that our time is valuable. And as nonprofits, we are always looking for how to maintain our organizations, how to fund our organization, have the staff to serve the community. So have that in mind, not only coming, help us doing this. It's only putting this flyer out. It's only filling out this survey. It's really time and the expertise. And not only from the nonprofits, but from community members, bringing their insights and their expertise.
Great.
And from the city's perspective, we have to be humble, and we have to continue to listen to the community. And even when they are having a tough conversation with us, we have to be open to hear what they have to say, because that's where the learning and growing takes place. And Lynwood and I view ourselves now as change agents for within the system, and for advocates for the community to push for systemic change in the organization where we work. There's a lot of good stuff going on in the city, but we are one of those groups that are just pushing for more and more change, probably more quickly than some may want. But that's our mission, is to first listen to the community, work very closely with the community, work with the community, being co-led and creating things together. And one of the statements that we have in one of our documents says that relationships and the resulting trust between individuals and groups and the city government is both the root and the sum of all engagement activities. And we actually believe that. So that's who we are about right now, is just pushing the boundaries within the city system.
Great. Fan or Lynwood, any last words there, quick? No.
Okay.
Lynwood. Oh, you're muted, Lynwood.
I just want to make sure that when we have these meetings and we have these programs, that we do bring community into this. They have a say and they should be involved. We shouldn't be talking about them. They should be in here talking with us and working with us to get through these problems and these issues and their concerns. So let's open the doors a little wider and let people in.
So I want to invite everybody to be thinking about how we can do that, challenge us to do that, and let's see what we can do to follow up further. We've had a couple of great comments come in. Already requests to share this recording with other members of the Duke community and the wider community as well. So I'm going to note that for the organizers. And also request directly both praise and thanks for all the work that our panelists are doing, but also I'm going to ask for links and information. I'm going to direct people to the list there that we've got in terms of advertising this event, but also the organizers might think about putting that out in the chat as well for this particular panel. And hopefully this is the beginning of additional conversations. Thank you We've got to get off the stage now for the next event, but sincerely, thank you. And let's see what we can do to push each other and connect further on this. We'll get through it together. All right, thanks.
Thank you.
Thank you.
Yeah.